Hi guys, welcome. Here we are in the AFE Training Center. Today we are treating one of our very own. She is a longtime patient here, really tolerant patient, and we have done these smooth threads on her before, so she knows what to expect. Of course, she has been cleaned very thoroughly, numbed adequately. We did use our BLT cream that we love, benzocaine, lidocaine, tetracaine, topical ointment. And this anesthesia does a really nice job numbing the patient. You can still feel the pinch a little bit and a little bit of a twinge as those threads go in, but it makes it pretty tolerable for the patient. We let that sit for about 10 to 15 minutes and then cleaned her skin once again. You can see here I am inserting these threads in kind of a sundial pattern. I like to kind of think like I'm cutting a pie, and that's kind of how I plan how many I'm going to put in. Typically, I'll use about 10 in this area, depending on the patient's needs. Of course, every patient's a little bit different. Threads inserted here are just for that lax skin in the submental area. So this is a treatment we do all the time. Here I am using twisted threads. So those twisted threads are just more collagen stimulation. I like to use them on all different types of patients, but if the patient can tolerate it, they are a little bit more pinchy just because you do have to get past kind of all those threads that are wrapped around that needle, kind of like a screw. You can see here she's not bleeding a lot at all. That one insertion site has a little bit of blood on it. No big deal at all. I'm going to twist these 360 and then I'm going to pull them out. She has not moved a muscle. She's doing just fine. Here I'm taking all three out at once. I'm going to clean that site and put a little bit of pressure on it. Sometimes those white little pledgets fall off and they don't follow you out. That's just fine. It's no big deal. We have just slight bruising in that one site. We're going to put some arnica gel on and it should go away. Here we are moving on to the neck. So you can see her skin is a little bit irritated just from that topical numbing. No big deal at all. All that red and blotchiness is just fine. I did clean her very well because a lot of patients, especially this time of year, have like a self-tanner on or a bronzer of some sort. So we want to be sure to get all of that off before we're introducing these needles into the tissue. You can see here that I am putting these into this patient's necklace lines. We oftentimes do these treatments for various reasons in the neck, either just kind of overall lax tissue. The tissue gets really thin here. So we can do broad treatment of the neck, or we can kind of isolate our sites to kind of where those necklace lines form. They're sometimes referred to necklace lines, sometimes they're referred to tech neck. We get them for multiple different reasons, but of course, tech, we're constantly always looking down on our phones, computer screens, you name it, and that kind of is what helps form these creases that we all hate. You can see here that I am using a little bit different thread here. I'm not using the twisted, I'm using the standard mono thread. So that thread is just threaded through that needle. And let's say it's a 29 by 30 thread, it's going to lay half the length inside the tissue. So it's going to lay about 15 millimeters long if the 30 is the length of the thread that I chose. You can see here she is bleeding a little bit. She has a hematoma in that one site. But it's going to go away just fine. I like to smooth with some arnica gel following the procedure. You can see here that I'm going in at a slight angle with all of these insertions, and then I'm leveling out once I break through, and this goes in very smoothly. Typically, if you meet any sort of resistance, you are a little bit too deep or a little bit too superficial. She's tolerating this just fine, and I can see that needle go in and just glide right under the skin. Again, going in very easily. Sometimes you'll run into an adhesion or scar tissue or something like that, and you do get a little bit of resistance. And depending on the location, patients will feel a little bit more ouchy than others. Sometimes when we place these threads, we get what we call zingers, and all that is the tissue kind of catching on that tail of the thread. Patients can experience these zingers for some time, but they typically subside once these threads start to really break down and integrate into the tissue, and then patients don't have any problem with it. When we put these threads in the neck like we're doing now, oftentimes I hear patients complain that when they turn to merge in the car, sometimes they'll just feel that thread, kind of a reminder that that thread is still there, not harmful at all. Once in a while, we see these threads not completely covered by tissue once we come out. If that happens, all we need to do is pull that thread and place another one. These are fairly easy to place. Once you do one, you just kind of get on your roll and keep going. You can see here it goes pretty quickly. And those little hematomas will not be a problem. Like I said, we'll use some arnica gel, and then we can always use oral arnica if necessary. You can see that I kind of use my non-dominant hand to manipulate the tissue, especially around where the neck curves. And here it looks like a greater deficit to me. So I am doing a couple extra threads in that area, kind of doing one right into the deficit, and then some threads kind of, either an X or on either side of that deficit. You're going to get about 1 millimeter to 2 millimeters of collagen stimulation on either side of that thread. So wherever you can kind of build that scaffolding, the web of those threads to kind of create collagen in that area, you're going to get the best effects and the most bang for your buck. So that's why I'm kind of methodically placing these threads. Again, I didn't plan it out with marker like we usually do, but that's okay. You don't have to. I've treated this patient many times. I'm comfortable with where I'm going. And those lines are kind of telling me, they're screaming where they want to be treated. So I'm going right into them and right around them. You can see here the tip of my thread on that last one was seeming a little superficial. No big deal. I adjusted and we're just fine. Thanks for stopping by. We'll be sure to show you more of these treatments in the future.